Welcome back to AllAboutRx. So, in this explainer today, we're going to build a really cohesive spatial map of the upper limb to help you absolutely ace those anatomy board exams. We're breaking this complex anatomy down into super digestible, highly visual pieces so you can pull it right from memory when it matters most. All right, let's just dive right into it.
You know, to really get the upper limb, we kind of have to look at its fundamental design first. While the lower limb is this robust, weight-bearing pillar built for locomotion, our upper limb? It's an absolute engineering marvel. It is specialized for something totally different: mobility, precision, and complex manipulation. Basically, every bone, muscle, and nerve we're going to look at is perfectly calibrated to let you do everything from, say, throwing a fastball to performing delicate microsurgery. So, here's our roadmap for today. We're going to walk distally down the arm through four main regions: the shoulder, the upper arm, the forearm, and the hand. And then we'll wrap it all up with a quick, high-yield recall summary. Okay, Region 1. Let's start at the top with the shoulder, which anchors the entire upper limb to your trunk.
The foundation of all that incredible arm mobility begins right here with the pectoral girdle. And what's actually wild about this is that it uses just two bones: the clavicle, or your collarbone in the front, and the scapula, your shoulder blade, in the back. That's it. Just those two bones securely connecting your entire arm to your axial skeleton. It's like this incredibly lightweight, flexible suspension system.
Now, because that bony structure is so minimal, the shoulder relies heavily on dynamic muscular support. Check out this mnemonic: sits. This perfectly maps out the four crucial rotator cuff muscles you absolutely have to commit to memory. We're talking the supraspinatus, infraspinatus, teres minor, and subscapularis. Think of these four muscles as dynamic ligaments, just hugging the head of the humerus right into the shallow socket of the scapula.
But, you know, that brilliant design definitely comes with a clinical trade-off. Pay close attention to this tip for your test, guys. The glenohumeral joint, the shoulder joint, completely sacrifices stability to give you all that amazing mobility. Because the bony socket is so ridiculously shallow, it's actually the most commonly dislocated joint in the entire human body. Seriously, if you see a dislocation question on your exam, the shoulder should immediately spring to mind.
Moving distally, let's check out Region 2, the upper arm. This whole area is defined entirely by a single bone, the humerus.
Structurally, the upper arm is neatly split into two main compartments. On the anterior side, the front, you've got your flexors. That's the biceps brachii, the brachialis, and the coracobrachialis, all powered by the musculocutaneous nerve. Now contrast that with the posterior compartment on the back, which is totally dedicated to extending the arm. This side relies on the mighty triceps brachii muscle, which is entirely controlled by the radial nerve. Grasping these two compartments is absolutely key to understanding how the upper limb functions.
And that brings us to a massive clinical correlation you need to know. Because the radial nerve wraps so tightly around the back of the humerus in the radial groove, it's super vulnerable to trauma. If a patient comes into the ER with a mid-shaft fracture of the humerus, that sharp edge of the bone can easily trap or sever the radial nerve. Since that nerve innervates your extensors downstream, the patient is going to present with a classic wrist drop. They literally just won't be able to extend their wrist. All right, let's keep moving down to Region 3, the forearm. This is where mechanical complexity really steps up, with two bones and some intricate nerve distributions.
So structurally, the radius sits laterally on the thumb side, while the ulna is medial on the pinky side. And just like the upper arm, this region is divided up into compartments. The anterior compartment handles your flexion and pronation, while the posterior compartment takes care of extension and supination. And notice how that radial nerve just continues its journey down the back of the arm to handle those posterior extensors.
Now, forearm nerves can get a little tricky, honestly, but to make sure you never mix them up again, I want you to anchor this mnemonic in your brain right now: MER. This links the median, ulnar, and radial nerves to their exact geographical compartments. Median rules the anterior front, ulnar sneaks down the medial side, and radial dominates the posterior back. If you remember MER, you can perfectly trace the wiring of the whole forearm. And this builds perfectly into our next big exam tip. You can test your understanding by connecting those specific nerves to their hallmark injuries at the wrist. You are, without a doubt, going to see these on your practical exams. So a median nerve injury leads to ape hand. An ulnar nerve injury gives you the infamous claw hand. And, like we just talked about, a radial nerve injury results in wrist drop. Memorize this trio, guys. It is absolute board exam gold. Finally, we reach Region 4, the hand. This is an incredibly highly specialized region engineered specifically for grip and fine motor manipulation. The sheer volume of bones packed into this tiny space is honestly staggering. You have a grand total of 27 bones in a single hand. Breaking that math down, it's 8 carpal bones in the wrist, 5 metacarpal bones making up the palm, and 14 phalanges for your fingers. I know, recalling those 8 carpal bones can be a total nightmare for students. But to master wrist anatomy efficiently, use this surprisingly effective mnemonic to memorize them in order. She looks too pretty, try to catch her. That perfectly translates to scaphoid, lunate, triquetrum, and pisiform in the first row, and then trapezium, trapezoid, capitate, and hamate in the second. Seriously, just write that down a couple of times and you will not forget it.
Okay, Section 5. Let's do a quick recall summary and lock in everything we've learned today before you head out. Go ahead and take a screenshot of this slide to remember the structural breakdown of the proximal anatomy. The upper limb anchors at the pectoral girdle with just the clavicle and scapula. Your dynamic stability comes from the sits rotator cuff muscles. And in the upper arm, remember the compartment battle. The biceps flex in the front and the triceps extend in the back.
And here's your final review of the distal limb. Your forearm relies on the lateral radius and medial ulna. Your nerve distribution is perfectly mapped out by the MUR mnemonic, median, ulnar, radial. And finally, you have the exact mathematical breakdown of the 27 bones in the hand, all perfectly designed for precision. Thanks so much for joining me here on AllAboutRx for this explainer. Building this kind of structured map in your mind is really what separates rote memorization from true clinical understanding. So I'll leave you with this final thought. How will you apply this proximal to distal structural map to confidently diagnose upper limb injuries the next time you're in the clinic? Keep practicing those mnemonics. Don't forget to check the link in my bio for more study resources, and I'll see you next time.